Well, hello there. This is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. Today we're going to speak about a subject called the new normal. That's right, the new normal. Now, I've read all kinds of articles about stroke and aphasia, and that seems to be one of the current buzzwords, the new normal. That means there's been a drastic change, and everybody's gotten accustomed to that change, and now that change is pretty much set. It's habitual, it's set in stone, and that's called the new normal. So anytime there's a change, and it can happen in, so many areas of life. We've been accustomed to doing things or whatever, and all of a sudden something comes along and there's a big change. That's the new normal. So it's sort of like this pandemic. That's kind of a new normal that many of us are home. But it also applies to aphasia, and I just want to just briefly make a comment about the new normal with aphasia. Now, with aphasia, there aren't a whole lot of therapists who are really skilled and expert in terms of treating aphasia. And so what typically happens is that they're given these talking machines, and that's what the person with aphasia gets. So it's a kind of a no-brainer, and a lot of times these machines are programmed, and when the caregiver and the person with aphasia are shown these programs, wow, they look terrific. Well, then what happens is they order one of these things, and then the caregiver has to program the darn thing or whatever, because it takes a long time. I remember I was working, and patients had these Dynavoxes when they came to me for speech therapy, and the families wanted me to program them. Well, I never wanted to program them because I wanted to work on speech. And so the topic again today is the new normal. So bottom line is, with aphasia, if you don't get the right care, if you don't get a therapist who's truly interested in helping a person speak again, not give them some kind of a talking machine or an A8 device or apps or any of that stuff doesn't really work. So what happens is the new normal for many people is, they just don't talk. And when you don't address talking for a while, and you don't have the discipline of knowing what to do to help a person talk, a loved one talk, then what happens is the new normal occurs, and that person just doesn't really speak again. And that's unfortunate, because that's what happens with so many people who've got aphasia. They don't have skilled care, and they're told that a machine or an app is going to do their talking for them. And sometimes they do. Sometimes the app does. He pushes a button and it says a word for the person, but that's not truly speaking. So what I'm suggesting is the new normal is learning what to do to help a loved one speak, and then work on that every day, just like cleaning your house, just like washing the dishes, just like using the bathroom, like brushing your teeth, like going to bed at a certain time. These are all regimens. These are all disciplines. And these disciplines, when you do them on a regular basis, get you results, whether it's good health or whether it's a good bodily functioning or whatever. So my suggestion is, let's have the new normal. Let's have the new normal speaking, and let's learn what to do to help a person speak, so that the new normal is not sitting around not being able to talk. It's learning how to talk and interacting with a loved one and family members and friends. Thank you very much. This is Mark Idelman, speech pathologist. If you like this video, please give us a thumbs up. And down below the video are a bunch of links to some of our weekly courses that we offer, our books, and our programmed video courses. So there's a lot down there. If you'd like to be following us on YouTube, there's a link there. And if you'd like to be a member of our newsletter and get weekly verifications and other announcements regarding some of the things that we're going to be offering, you can click there, and we'll send you weekly emails letting you know about different things that you can learn and what some of the new developments in the field are. So this is Mark Idelman, speech language pathologist. Have a great day. Looking forward to seeing you soon. Bye-bye now.